Telehealth makes care more convenient for patients and more flexible for practices, but it also makes HIPAA easier to get wrong. A video visit, a remote monitoring device, even a follow-up message can create electronic protected health information, or EPHI. And once patient data moves through screens, apps, and networks, the rules do not disappear. In fact, after the temporary COVID flexibilities ended, the standard is clear again. If telehealth touches patient information, it has to be secured, documented, and managed like any other part of care. Here is the simple way to think about it. Telehealth is not a special loophole. It is ordinary healthcare delivered through digital tools. So the same duties still apply. Protect privacy, control access, document what happened, and choose vendors you can trust. Start with the platform. Not every video app is HIPAA compliant, even if everyone already has it on their phone. A compliant platform needs strong encryption, access controls, audit logs, and a business associate agreement, or BAA. That BAA is the vendor's written promise to safeguard patient information and share responsibility for handling it properly. Platforms like Doxy.me, Zoom for Healthcare, and enterprise versions of Teams or Google Meet may qualify when configured correctly. Consumer tools like standard Zoom, FaceTime, or ordinary messaging apps are a risky shortcut. Then comes consent. Patients should understand what telehealth is, what the risks are, what happens if the technology fails, whether anything is recorded, and when in-person care may still be needed. Good consent is not paperwork for its own sake. It sets expectations before anything sensitive is discussed. Right before a visit, staff should also verify identity and make sure the patient is somewhere they can speak freely. Next is privacy in the moment. The provider's room matters. The patient's room matters too. Screens should be positioned carefully, unauthorized people should be kept out, and virtual waiting rooms should be used to admit the right patient at the right time. Small habits prevent big mistakes. After that, think about documentation. A telehealth visit should be charted with the same discipline as an in-person visit, plus a few telehealth-specific details. Record the date and time, who participated, which platform was used, whether consent was on file, and any technical issues that affected care. If a session is recorded, the recording must be encrypted, access must be limited, and retention rules must be defined. The same logic extends beyond video visits. Remote patient monitoring creates a steady stream of health data, so devices, transmission paths, alert thresholds, and response procedures all need to be secured and documented. Digital communication matters too. Secure patient portals are usually the safest choice because they authenticate the patient, encrypt the message, and leave an audit trail. Standard text messaging does none of that well, which is why ordinary SMS should not carry sensitive information. Imagine a small clinic launching virtual follow-ups. At first, the team thinks telehealth just means sending a meeting link. But once they walk through compliance, the picture sharpens. They choose a platform with a BAA, turn on waiting rooms, assign unique logins, recommend two-factor authentication, collect telehealth consent, train staff, and use the patient portal for follow-up questions. Now the visit is not just convenient, it is defensible. If something goes wrong, they can show what safeguards were in place, who had access, and how they handled the interaction. That is where HIPAA Agent helps. It brings the moving parts into one system. It can scan telehealth infrastructure for security gaps, help generate policies that cover virtual care, track BAAs, support staff training, verify encryption, and produce evidence that is ready for audits or reviews. Instead of relying on memory and scattered documents, a practice gets a clearer picture of where its telehealth compliance really stands.
Less guesswork. Less scrambling.
More control. The key takeaway is simple. Telehealth compliance is not about making virtual care complicated. It is about treating virtual care with the same seriousness as care in the room. Choose the right platform, get the right agreements, protect the connection, verify the patient, document the visit, and train the team. Do that consistently, and telehealth becomes what it should be: easier for patients, practical for providers, and safer for everyone involved.